welcome back to the Digital Health and Wearables series. Today I have another magnificent guest and leader for you. But before I go ahead, I want to ask you to subscribe to the channel. Magnificent content there with the previous guests. Also, let me acknowledge our digital health platform, Clinitouch V, and our series partner, Fujifilm Healthcare. But let me introduce you to our guest today. He's Colin Hung. He's the CMO and editor at Healthcare IT Today, also an healthcare advisor at Venture Lab, and the co-founder of HCLDR. Colin, how are you?
Good, good. It's great to be here. Thank you so much for the opportunity.
Oh, brilliant. Thank you so much for connecting and accepting the my invite. We're talking before the recording that we feel that we know each other, but we never really met. We're gonna meet at IMS, right?
That's right. That's right.
Yeah.
And that's the fun part of, being on social media, right? You get to know people, you get to meet people, and then when you meet for real in real life, it's like you've known them forever, and that's a great feeling.
Yeah, absolutely. I have so many of these cases too. So brilliant. So today we are here to discuss digital health startups. And the first question that I have for you, Colin, is what should digital health entrepreneurs be prepared for when they first start?
That's a great question. Yeah, I through my work at Healthcare IT Today and at Venture Lab, I have the good fortune to work with a lot of digital health entrepreneurs. And one of the things I always advise them to is just be ready for the complexity that is healthcare. Healthcare is not like any other business. It is very complex because there's a lot of not only regulation, which I think most people know about, lots of regulations, but also just in terms of the entrenched workflows and the complexity of the relationship between a clinician and a patient. This is not your typical supplier customer kind of relationship. And I think some entrepreneurs who don't come from healthcare, but who see an opportunity, sometimes don't realize that. And so, one of the things I always prepare them for is be prepared for the timelines being a lot longer than you think. Sales do not happen in 3 weeks in healthcare. Getting a prospect does not take a few days in healthcare. It takes a while. Things take a lot longer than you think.
Brilliant. Colin, that's a magnificent point. I have my startup experience from 2015. I've been in health for a long time, but I have my experience about the frustration entering the market with the product, everything. But also, I could go into one, I'm not going to, but I have a very recent frustration the last 3, 4 days with an experience in here with the NHS in UK about my COVID pass and results. And I've been calling, and seriously complex,
Yeah.
really complex. I make about 9, 10 calls and I just go around in circles. Different advice, contradictory advice. It's it's what you describe is what I really experienced in the last 3, 4 days. So magnificent insight. And
Yeah.
the second question that I have for you, Colin, is what are some common traps that digital health entrepreneurs fall into?
Yeah, I think the biggest trap that new people to health fall into, new entrepreneurs who have not worked in healthcare, they believe that just because they have a great product, that people will come running, and that if they just showed it enough to people, that all of a sudden hospitals and clinicians or patients would want to buy it. And the answer that is, although that might be true in some cases, for the majority of cases, that is not the case. There are lots of fantastic products out there. There are lots of fantastic solutions already out there. The question is, why haven't healthcare adopted them? And the answer is budgets, of course, but also because, well, you need to get so many people on board to sell anything and get anything adopted in healthcare. You have to get the clinicians on board. You have to get the administrators on board. There's all the implications for payers, and then there's unions. And there's so many layers of people that get involved in adopting technology. It's not as simple as you have a better mousetrap, therefore you must buy it. Like it's not that simple. And so that's one of the most common traps I see is people think they can just build a great product, put it on the market, and all of a sudden people will want to adopt it. They might want to adopt it, but it's going to take a lot of work and effort to actually get it into the healthcare system. So that's one trap. The other trap is just because you may have had one experience with healthcare doesn't make you a healthcare expert. And I've seen this many times. I think it could be served if you had a bad experience in healthcare, that could be fantastic inspiration for you to create something better. Love that. But don't think that that one experience is enough. You need to talk to other patients. You need to talk to clinicians and realize, oh, like I want to solve this problem, but I need to factor in like how does the doctor work? What's the other side of it like? I can't just solve it for one side in healthcare. So that's another trap that people fall in is they only take one perspective and try to push their solution in. So I would say those are two common traps that I run into a lot.
Brilliant. Certainly the first one, more complexity. And this is very common, isn't it? The complexity, the layers, I mean, is a very difficult, is a very unique industry, as you know. I'm now kind of on a mission to make healthcare and complicated with my company. But I've been in healthcare and experienced so many things, the startup world. What you describe is actually very, very true. You build a product, you think, oh, every entrepreneur, including myself, we think, okay, I'm going to build this product. We're going to hit the insurers. But it's only one product they're going to sell to the insurance company. So what about the other thousands and thousands? Everyone thinks they're going to build a great product. They're going to go to the insurance. Here we are. Look what I've got. And it's not real. But when you are in a business, you truly believe because you're doing things right. You truly believe, okay, I'm going to go to the and how difficult it is, for example, to sell to an insurance company.
Yeah, and that's the case. Like I think that's what frustrates a lot of people about healthcare, including people who've been in it for a long time, is that it is so difficult to move the ship, right? Like we all would love to change the way certain aspects of healthcare operate, but it's so hard to because there's so many other parts of the ecosystem that have to agree to those changes. Like we would all love to change the way reimbursements are done. Like I don't think anybody likes it, but to change it, you need to involve so many parts, like the government, payers, providers, coders. There's a whole standard out there for ICD-10. I think it's just it's amazing when you think about that level of complexity. So I think that's why I think healthcare does get a little bit of a bad rap. That to say we're behind the times and we're super slow, it's
Mm.
not because we don't want to adopt technology. It's actually on the contrary, we want to. It's just it takes so much, and there's so many layers to it. And again, I think that's just a trap that people don't realize if they haven't worked in healthcare, and when they run into it, they get super frustrated, right?
Mm. Fantastic. Yesterday, Colin, I'll give you this example. I went to my GP practice, the doctor, and to access the electronic medical record, they told me it would take 28 days. And I've been hearing this conversation in UK since 2015. Centralized electronic medical. And I was so frustrated. And I am in healthcare. I understand how difficult it is, yeah. And I was thinking, I started to criticize the leadership in my head, public health, and I was thinking, 7 years down the line, this is not done yet. And I know how healthcare works, and it's very challenging. It's very challenging, different systems, different providers, different innovators, at different paces, at different times, different geographies. So, yeah, I know healthcare, but I had a really life experience in the last few days. And Colin, the third and last question that I have for you, we're talking about digital health startups, and we went a bit more broader than just the startups. But what startups are you excited about?
I'm always excited about startups that are working in the patient experience space, anything to improve the life of patients. That's always been a passion of mine, and I enjoy talking to entrepreneurs in those areas and specifically. I also think that the ones who are doing well in that space are ones that are also considering what's happening with the providers, right? They're not just improving the patient experience, but also the clinical experience. So making things easier for the clinicians and so forth. So there are some pretty interesting startups out there that are doing things relative to AI. So using AI to look at the patterns of engagement for a patient, that look at the behaviors of a patient based on trackers or other behaviors that they're doing on their cell phones, and then adapting the experience that they have with healthcare to that. So, as a quick example, there are a lot of startups, I won't name them, but that are doing some really cool things around like it knows how you use your iPhone. And do you tend to answer this type of email versus this type of text? And then it applies that and goes, well, why don't we apply that same methodology to your medication? Because it's very important you take your medication. It's very important that you adhere to the program because you want to get better and we don't want to see you back in the hospital. So why not use that intelligence to improve that aspect, right? And so there's some really cool things happening in that space, and I'm pretty excited by what I see there.
Brilliant. Colin, thank you so much for your participation, your magnificent insights, your expertise. You are in the industry for quite some time. I really feel that I know you, but also I feel we have a common passion for healthcare, and we know a bit about healthcare, and we have this common bond, which is fantastic.
Yeah, that's kind of the way it is, right? Like we all meet each other and we all have our passion to improve healthcare. We're all been in it for a long time, and yeah, I mean, as much as we are frustrated about it, we're also very encouraged by all the work that every all these amazing people are doing.
Yeah. Colin, I don't know if you watched the other episodes, but I finish all my episodes in the same way, which is I call 1 minute of fame. Over to you to round up. I mean, you can talk about anything, your professional achievements, a company, a bit of a promotion, shout out, personal life, anything whatsoever. Over to you to round up. 1 minute of fame.
Wow, thank you so much. That's what am I going to do with the whole minute? I will actually say this. For any healthcare entrepreneur or any budding entrepreneur that's looking to get into healthcare, please come on in. As much as we say healthcare is very insular and very slow, we need outsider perspective. We need new blood. We need new thinking. And my advice and my recommendation to you is don't give up. Right, you're going to run into a ton of roadblocks, probably more than if you decide to go into retail or manufacturing or banking. You're going to run into a lot of it, but don't get discouraged. Talk to people like the guests you've had on your program here, and get to know them, and they'll help you navigate this world and help you understand all the nuances. And then once you understand it, then you'll be able to make that breakthrough that you're really looking for. Because we need you. We need the innovation that a lot of companies out there are bringing forward. So that's my message to all the entrepreneurs listening to this.
What a fantastic, valuable, magnificent way to finish. Very encouraging, inviting, and inspiring. Colin, thank you so much again for your time, for your expertise, that motivational insight, and your passion for the industry and your magnificent work.
Well, thank you for saying that. I appreciate that, and I totally am looking forward to seeing you in person soon.
Yeah, we're gonna do some tweeting and some shots together, right?
For sure. For sure. We gotta take a selfie.
Yeah, yeah, that's for sure. I'm gonna round up now. Colin, again, thank you so much. To all our viewers and listeners, make sure you subscribe to the channel. Also, connect with Colin. I'm going to post here his socials, his LinkedIn, and his Twitter. Reach out to him. He knows the healthcare industry, as you can heard inside out. He can be very valuable to you. Make sure you connect with him, ask him questions. And let me acknowledge our digital health platform, Clinic Touch V, and our series partner, Fujifilm Healthcare. Subscribe to the channel, and I'll see you all next week.